Okay, so a few more words about macronutrients. So this was showing that if we take a group of weight loss patients and we substitute more protein for carbs, that the group with the higher amount of protein was more successful in their weight loss and lost more of their body weight. This is showing a little bit different macronutrient substitution. This is showing overall your typical weight loss population substituting more carbs and less fat for vice versa. So we're looking at low fat versus low carb and the success that patients had. And what you see, and we talked about this earlier, is that for the average patient, lower carbs worked better. And so these patients lost more weight having a low-carb diet than this subsegment that went on the low-fat diet. Now, again, for the average weight loss patient that's dyslipidemic, that's the important stratifier here. Dyslipidemic patients with high triglycerides, low HDL do typically do better on the low-carb diet. However, the subsegment of weight loss patients that might have strictly hyperlipidemia with high HDL typically do better with their long-term morbidity and their success with a lower fat type of protocol. And so that would be important in terms of the vast majority of your weight loss population will do better on the lower carb program, but you probably have a subsegment there, a smaller number that may do better with low fat. This is just a graph. It's showing the same thing. It's showing that if you have a group and you give them less carbs, a little bit more fat, they're going to have more success overall in their weight loss. And so this group had a little bit more of the carbs and a little bit less of the fat and did not lose as much weight. And that's a fairly typical result.